Um, well, I've had media training, and part of your media training is that you answer the question you want to answer, not necessarily the questions that you've posed. Nonetheless, I think I will at least indirectly
do that at your own risk.
respond to those questions. I think we've heard some very inspiring examples of very exciting work that's being done, and we've also heard some brilliant framings today. I'm going to respond to this both as a member of the Population Health Improvement Roundtable, but also an alumnus of the Equity Roundtable. So I sort of feel like I'm working at the intersection here, and I may end up saying something at the end that's going to make both roundtables angry. So we'll see. I also have to, as sort of context, say that some of the discussion about the movement has felt a little bit about creating movements, has felt a little bit abstract to me. I had the privilege in my youth, and remember Marshall Ganz's paper points out that movements are started by young people and led by young people, and just point that out to all of us here. I had the privilege of working for the National Gay and Lesbian Task Force in the early and mid-1980s, and then for a number of AIDS organizations after that, and so had the privilege of being part of the LGBT movement in sort of its adolescence, I guess you could say, and being part of the HIV movement from the very beginning. And I keep wondering about whether if we had framings like we heard today, would we have gotten things done better or faster? And I think one of the things that's fascinating about this conversation is I find a lot of these frames interesting. I found the initial conversations we had about theories of change terribly exciting. But the people who are usually in the middle of doing this work are not thinking that way. They're out there doing what has to be done because of the urgency of now. And I think it's more an observation than anything else that we probably need to keep that in mind and not get overly concerned about theory of change and framings, and really think about what it's going to take to get the work done for the people that we are so concerned about. So I have about 5 general observations and then some recommendations for how we go forward. First, I think we need to distinguish between a social movement and between political activism and political organizing. So there's organizing associated with a social movement, but then there's also organizing associated with political activism. And to be perfectly honest, and I've said this to the organizers of this session, the Log Cabin Republicans are a part of political activism. They are political operatives working within a certain framework. They're not part of the social movement. The social movement, if you wanted a social movement that is part of the LGBT world, would have been, I think, something like the Freedom to Marry or the marriage equality movement. That was a social movement, not something that was trying to influence the politics of the partisan politics or partisan outcomes of elections. And I think and I would say that had Stonewall Democrats been here as well. I think that's a very important distinction, and we need to understand that what we're talking about is something that has to be outside the partisan arena. There will be those who appropriate it for partisan purposes, but we have to be framing our discussion in something that is outside that partisan conversation, because it's about a social movement that should be able to embrace everyone across the spectrum if we find the right arguments and if we find the right evidence. Second observation would be to question, I guess, whether we need to be creating a population health movement or acknowledging that there is actually a population health movement already in place, and that perhaps we need to coalesce all of those activities that are happening, shine a light on them, but anywhere you go in this country, there is population health work being done. It's happening in, I was at the New York State Population Health Conference. It's happening in Syracuse. It's happening in the Bronx. It's happening in Akron. It's happening in Minneapolis. It's happening, all the work that California Endowment is doing, Kaiser Permanente is doing, Robert Johnson is supporting through the Roadmaps program. I should try to list every funder in the room, I know. That work is already happening. And a movement doesn't get created from the top down. To a large degree, it bubbles up, and then at the top, we need to embrace it, support it, and find ways for people to learn from one another and to coalesce. But it is ultimately happening already. And so I'm reminded of Ned's comment about Bill Moyers and about despairing. And we in public health do such a good job of despairing. No one understands us. No one gets it. We are doing God's work, and why isn't everyone falling down and saying you're wonderful? But in fact, it is happening, and too often our conversations are about despair when there's all this exciting work happening that we just need to shine a light on. Third observation, who leads? So much of this is about challenging what is currently happening. And I think we have a fundamental problem in public health, in population health, is that so many of us either work for the government or are funded by the government at a time when part of what we need to do is challenge the government. It's easy for me to say TIFA doesn't take government money, but I think that has its challenges. And I'm the first out there saying the government should be supporting a lot of the kind of change that we are talking about. But that comes, I think that's a challenge that we need to think through, because that comes with compromises, because they're just so far that the government is able to push. And that perhaps may be a conversation to have with our philanthropic friends here about a division of labor, where philanthropy can push the more cutting edge changes that then can be proven for government to adopt. Fourth observation, do we need an enemy? I am not convinced about that at all. Ray Baxter mentioned, the HIV movement. And this has come up a number of times where, if you've been in public health long enough, then at some point you worked on HIV, even if today you're doing obesity. And I always think of this issue to the desire to demonize, as opposed to, I'd replace demonization with constructive antagonism. And I think of the relationship that the HIV community has had over the last 30 plus years with the pharmaceutical industry. Angry with pharma about some of its decisions, particularly around pricing. Needing the product that pharma produces. Sometimes on the same side as pharma in wanting the FDA to move faster in approving drugs, sometimes on the same side as pharma in pushing for innovative approaches to research, and then being able to turn on a dime and, some of my friends handcuffing themselves to the desks of, drug companies to protest their pricing policies. So finding that kind of constructive engagement. Fifth and last observation, and then I will in 1 minute and 50 seconds say what we should do next. Do we need a population health movement, or do we need a health equity movement? I would argue we need the latter. Population health is a means for achieving health equity. It is not an end in of itself. And in fact, if we think about being strategic, the messages that resonate around fairness and equity are going to be a whole lot easier to explain, even if we haven't been incredibly successful yet. A whole lot easier to explain than what is population health. Because we've had many long meetings about what is population health. And I bet we still couldn't agree in this room what population health is. And if we can't agree, how on earth are we going to communicate that? And the equity issue falls into a sweet spot where the political debate is today. President Obama's speech yesterday about equity was talking in a much broader sense around inequities in the society, but think about what that may mean as a signal for what he's going to be talking about for the rest of his administration. And the fact that he mentioned economics and class as a factor in health outcomes. And can that be a way of framing some of this discussion? So what does that mean for the work of the roundtables? I'm going to put some thoughts out there. Do we need 2 roundtables? Or should we be combining forces? Not going to comment any further than that. I think we need to recognize that the kind of change and the kind of leadership that makes a movement, frankly, doesn't originate in a roundtable committee. But the work of a roundtable can be very supportive. So I'm thinking of what Doran said about making visible what is already there. This is something roundtables can do a beautiful job of, shining a light of many more examples than we heard today of the kind of great work that is already happening as part of a population health equity movement, and helping people see this in other communities so they can replicate that. And then responding, I think, to building on what Tony said, and I think an answer, I think, to Martha's question about what can we do, some of it can be about building the evidence base. And so Tony's comment about how do we show the value of empowerment? I started in this movement, in the HIV movement, at the Denver conference that resulted in the Denver principles that started the People with AIDS movement, where the people with AIDS came together and said, we want to be involved in decisions that affect our lives, and no one else can speak for us. And so that whole notion of empowerment is certainly central to how I see we do health. But we do need to do it. It sounds wonderful. I think we have some evidence that supports it, but can we frame it and document it in a way that people will understand that that broader sense of empowerment is so important? And I think we can look at the various frameworks that Ned presented, that Tony presented, that everyone presented, that Michelle presented. Everyone had a framework. There were a lot of commonalities around that framework. And so what are the common research questions? What is the common evidence that anyone putting their own framework together, because they all have to draw their own blood, that we can help identify, pull that evidence together so the next person developing a framework for their community will have some support for it. So I think there are lots of ways that we can be supportive of a movement, and particularly a movement that frames its work around equity. And I think we've seen a start for that today. Thank you.